Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about influenza. Influenza, or flu, is a contagious viral infection that attacks the nose, throat, and lungs. It is spread in the United States from October through May, although it is more common in the winter months. There are many different strains, and they may change each year or throughout the year. New strains can lead to epidemics or pandemics, which are widespread. Flu may be labeled as type A or type B. In the United States each year, flu affects 5 to 20% of the population. It also leads to more than 200,000 hospitalizations and anywhere from 3,000 to 49,000 deaths. About 90% of all flu-related deaths are in those 65 years of age and older. Flu is spread through respiratory droplets up to 6 feet away. This can happen through coughing, sneezing, close contact, kissing, sharing drinks or utensils, or touching surfaces with the virus and then touching your eyes, nose, or mouth. It can spread one day before symptoms start until about 7 days after. The incubation period for flu is from 1 to 4 days, and the symptoms can last for 2 to 7 days. The symptoms, which often come on suddenly, include fever, chills, sore throat, muscle aches, fatigue, cough, headache, runny or stuffy nose, and occasional diarrhea and nausea in children. To diagnose flu, a medical provider will perform a physical examination to look at signs and symptoms. They may also order a lab test. A rapid influenza diagnostic test, where a swab is taken from the back of the nose or throat, may be done, although the results are not always accurate. A rapid molecular assay may also be done, which is more accurate than the rapid flu test. Specialized laboratory tests are the most accurate, although they do take longer. Flu normally resolves all on its own. The best treatment includes rest, hydration, and over-the-counter medication such as acetaminophen, ibuprofen, or cold and flu medications to help with the symptoms. No aspirin should be given for teens or children due to the potentially rare but fatal condition called Reyes syndrome. Antiviral medication such as Tamiflu or Relenza may be given for those who are very sick or are high risk for complications. It is best used if started within 48 hours of onset of symptoms. Populations at higher risk for complications from flu include infants or young children, those 65 years of age and older, pregnant women and those up to 2 weeks postpartum, those who are immunocompromised, such as due to HIV, AIDS, or certain medications, and those with certain chronic medical conditions, such as asthma, neurological conditions, chronic lung disease, heart disease, blood disorders, endocrine disorders, kidney disorders, liver disorders, metabolic disorders, morbidly obese, or those younger than 19 on long-term aspirin therapy. Flu can lead to many complications, including pneumonia, bronchitis, heart problems, ear infections, blood infections, seizures in children, worsening of chronic medical conditions, hospitalization, or even death. You should see a doctor if you have flu symptoms and are at high risk of complications, if you have a fever longer than 3 days, if you're not improving after 1 week, or if you have severe symptoms. Severe symptoms in an infant may include being unable to eat, having trouble breathing, no tears with crying, or significantly fewer wet diapers than normal. Severe symptoms in children may include fast or trouble breathing, bluish skin, not drinking enough fluids, not waking up, being very irritable, having a fever with rash, or the symptoms improve but then return with a fever and worse cough. Severe symptoms in adults include difficulty breathing, chest or abdominal pain or pressure, sudden dizziness or confusion, severe or persistent vomiting, or the symptoms improve, then return with a fever and worse cough. The best prevention is to get your flu vaccine every flu season, since immunity wanes and the virus strain changes. Everyone 6 months of age and older should receive the vaccine. For those ages 6 months through 8 years, they may need 2 doses in the same season. Since those under 6 months of age cannot receive the vaccine, caregivers should be vaccinated. It takes about 2 weeks for the flu vaccine to provide protection, so it is best to get it before flu season starts, but you can get it as long as the flu viruses are circulating. The flu vaccine can prevent flu, make it less severe, prevent spreading the flu, and protect babies after birth if the mom received the vaccine during her pregnancy. The flu vaccine cannot prevent flu caused by a strain not covered in the vaccine, prevent other illnesses, or cause flu. Some other methods of prevention include washing your hands often, not touching your eyes, nose, or mouth, avoiding close contact with people who are ill, avoiding crowds during flu season, maintaining a healthy diet and exercise to help boost your immune system, staying home when sick and at least 24 hours after fever is gone without medication to prevent further spread, and not coughing or sneezing in your hands to prevent the spread of the virus. Instead, you should use your upper arm, the inside of your elbow, or a tissue. This concludes the influenza presentation. If you have any questions or concerns, you may visit any of these websites, or you can contact your local health department or physician. Thank you.